Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you how to check the tricep deep tendon reflex. So let me show you how it's done. Okay, now we're going to check the tricep deep tendon, and it is located on the back of the arm right above the elbow. And if you're just new, you're trying to find it, what you can do is just extend the arm out, and you can feel just right above the elbow that deep tendon. So what you're going to do is you want this whole area to be relaxed. So we're going to help the patient dangle their arm, tell them to let it go limp. And this is going to check C7 to C8. What we're going to do is we're going to take the hammer and just briskly hit on that deep tendon. And what you'll see is extension of the forearm and a slight contraction of the tricep. So here we go. And seen that flex and that contract. Do it one more time. Okay, so that is how you check that deep tendon reflex. Now check out my other videos on how to check the other 4 deep tendon reflexes, and consider subscribing to this YouTube channel.
Good morning. Here we are discussing about the posterior compartment of arm. The boundaries of the posterior compartment of arm are anteriorly the posterior surface of the humerus, medially medial intermuscular septum, laterally lateral intermuscular septum. The main contents of the posterior compartment of arm are the triceps brachii muscle, the radial nerve, and the profunda brachii artery. First we are discussing about the triceps brachii muscle. The triceps brachii muscles have 3 heads of origin. The first one is the long head, which originates from the infraglenoid tubercle of the scapula. The second one is the lateral head, which originates from the oblique ridge on the posterior surface of the humerus. The third one is the medial head, which originates from a triangular area on the posterior surface of the humerus below the spiral groove. These 3 heads converges and fuse to form a superficial tendon which inserted into the posterior 2/3 of superior surface of the olecranon process of ulna. The nerve supply of the triceps brachii muscles received from the radial nerve. Each head receives its own branches, and the action is the chief extensor of elbow joint. The radial nerve. The radial nerve is the continuation of the posterior cord of the brachial plexus. In the upper part of the arm, the radial nerve lies behind the brachial artery. Before reaching the spiral groove on the posterior surface of the humerus, the radial nerve enters the lower triangular area along with the profunda brachii artery. Then both artery and nerve enters the spiral groove between the long head and the medial head of the triceps, and then it runs downwards laterally along the groove in between the lateral head and the medial head of triceps. In the lower part of the groove, they are separated from the bone by the origin of the brachialis muscle. The radial nerve, along with the radial collateral branch of profunda brachii artery, appear in the anterior compartment of forearm by piercing the lateral intermuscular septum. The main branches of the radial artery, which supplies the long head, lateral head and medial head of the triceps brachii. Nerve to medial head passes through the muscle and supplies the anconeus. It also has articular branches which supplies to elbow joint, and there are cutaneous branches, lower lateral cutaneous branch of the arm and the posterior cutaneous branch of forearm. The cutaneous branches are the lower lateral cutaneous branches of the arm and the posterior cutaneous branches of the forearm. Profunda brachii artery. It is a large branch arising from posterior surface of proximal part of brachial artery. It follows the radial nerve to enter the spiral groove on the posterior surface of the humerus between the long head and the medial head. It gives off middle collateral artery and it terminates as radial collateral artery. It also gives muscular branches to these muscles, a nutrient artery to the humerus and an ascending artery or deltoid artery, then cutaneous branches. Thank you.
Now we're going to look at the posterior arm and go through the triceps muscle, and this patient here has awesome definition. We can see the long head through here, the deep head right there, and then the lateral head coming there. And let's do a quick review of the origin and insertion. So we know this long head is long for a reason because it actually starts up in the shoulder, the infraglenoid tubercle, and then we have the deep head here, and then the lateral head here. The lateral head starting above the radial groove on the posterior humerus with the deep head below the radial groove on the posterior humerus. All of them sort of inserting right into that olecranon down here at the tip of the elbow. Okay, relax for me there. So to muscle test this, what we're going to do is bring the elbow to 90 degrees. And a really easy way to spare your body and get a good palpation at the same time is just have them hold there nice and strong as you slowly lift up and palpate across all these muscles. And I can feel them all engage right under my fingers. I can walk up and down the muscle to see if there's uniformity with the contraction all through. Check out the deep head, the lateral head, the long head, slowly load off. So just to review that muscle test for the triceps in a slightly different angle here, this is actually going to be really useful for smaller practitioners that have a hard time generating force against a powerful muscle group. Just going to cup around the wrist like that, palpate across the back of the tricep, and then slowly lift your body weight up while palpating through the muscle and all the heads of it. You can get an appreciation of how strong this muscle group is. If I just keep lifting, he's just going to come right up off the table as he keeps fighting me. And some other ways to do this would just be standard position like this. It would be very similar check for the brachioradialis where I'd pull the wrist down, but now I'm actually just going to push the wrist up. Same kind of thing. I can still palpate out back with my fingers. Again, it's more just the distal fibers I'm checking with that, but a really nice way to do it as well if you have the strength to do it. Just to show you guys a little bit of a variation on the triceps muscle test, you can look specifically at each of the heads. So in this test position with the elbow at 90 degrees, we're going to have a thumbs in or a pronated position on the wrist, and then again I'm slowly going to load in. And this will check primarily the long head. Of course, the other heads of the tricep are involved. If we move the wrist to a neutral or thumbs up position and do a resisted challenge there, this is going to be a little bit more of the deep head of the triceps. And then finally, if we rotate the wrist all the way out into a thumbs out or supinated position, this is going to check the lateral head of the triceps. And again, I can always palpate with my fingers out back to make sure there's contraction happening underneath each time I do this.